Assalamu alaikum wa rahmatullahi wa barakatuh. Shukran, Dr. Majd, for your presentation. There was the last bit where we were talking about collaboration platforms for remote case consultations. We would like you to repeat the last part of the video because it was omitted from the last recording. If you can, please begin. Thank you.
Yeah, thank you. What I said about this platform, it's not software, it's a platform. It's like the Microsoft Teams that we usually use in texting. This platform, you can form groups of employee with technicians, with specialties. You can chat and react and consult with other specialties about cases. You can watch real-time designing for restoration. You can see real-time bone sounding, implant designing, everything. One of the advantages that I said before I played the video is the smart design based on talking face-to-face to the patient, because you are seeing the patient face-to-face, you're seeing him smiling, talking, which is considered three-dimensional smart design, which give you more information than the two-dimensional smart design. So everything you will see in this video, it's not the platform itself, it's just a sharing platform, like you share PowerPoint in the Microsoft Teams, and this is the beauty of it, which makes everything accessible to any software, to any patient, to any patient data, any patient designing file, patient history, anything, could be anything. And you will see the first part, there will be chatting between different specialties, giving their opinion about the designing the case. And you will also see an example of real-time bone sounding, implant designing, smile design. Okay, I will play the video now.
If you can comment on the video while it's working.
Yeah, as you can see, this is a chat box where everyone communicates. And these are groups of specialties of technicians. Here they design a case, real time. Everyone here is giving their opinion about the case. You can also save files like Microsoft Teams. You can save files, you can retrieve them, you can rediscuss them, download them. This is the bone sounding, real-time bone sounding. And the smile design, of course. Thank you. That's it, Dr.
Okay, thank you very much, Dr. Majd, and I'll begin commenting on the presentation in a moment. Okay, thank you, Dr. Majd, for this interesting presentation. It was very interesting, and as you said, while we were on a break, on the recording, you told me that it needs a lot of more additions. You wished you could have time to do them, and you recommend for next year to divide this by 2. Okay, so I would also recommend the same thing. Thank you very much for the recommendation. I will back it up, and inshallah ta'ala we will make it in the next year's plan. as well. Okay, you went into during the presentation, you went into the topics very well. The orthodontic collaboration, you talked about them. One thing that I didn't see in the ortho, I love the presentations and the cases, and these are actually the cases that we get in terms of the need for consultations with the ortho. And these are, you could say, these are everyday's consultations in our clinic. So the choosing the material and the cases was beautiful. I know there will be more cases to add in terms of management of spacing between teeth and the role of orthodontics in them. One thing that I wish I could see, I'm not sure if it is more to the orthodontics or perio, but it's worth mentioning it from here, which is using mini implants to aid orthodontics or periodontics. Okay, so the use of mini implants, I haven't seen.
I actually had a case report that talked about mini implants, but
you didn't
I didn't have time to organize it. But I had one.
Okay, good.
I had, yes,
just 2 to
involved.
3 slides about this subject, and of course
Yeah.
next year they will elaborate more when they further divide the lecture. Okay.
Yeah.
Another thing is about palatal expansion. You haven't talked about palatal expansions. These are also parts, some of the cases that we need, where we need to change the bone relationship together. So it's not only spacing between teeth, we also sometimes need to change the bone morphology. So it's part of the bone palatal expansion procedures. Just 1 or 2, Yani. And for each subject I'm asking for at the moment, just add 1 or 2 slides from a systematic review or a review or a case report where just mention them. So next year they will further elaborate on the subject. Okay. So palatal expansions is part of the work that we do with ortho. Okay, I loved where you talked about the enhanced tooth movement by surgery, piezoelectric, and all of these types of orthodontic expansion. These are not actual expansions, they are acceleration of the tooth movement by altering the alveolar bone. So I love this part. I enjoyed it very much. Especially, I had somebody who had done some work, my husband had done some work with an orthodontic master student. So it was close for my interest as well, because I was also watching them while they were doing that research. Okay, you didn't talk about intrusion. You talked about extrusion, but you haven't talked about intrusions with ortho. You haven't talked about tilting, retilting, or adjusting the tilt of teeth, especially when it's at the 8 or 7, when it's mesially tilted. So tilting teeth and intrusion of teeth. If you can add those 2 subjects as well. We talked about mini implants. Okay, deep marginal elevations. You talked about deep marginal elevation in terms of surgeries. Okay. Okay, I love the work where you talked about, these are the minimally invasive techniques for enhancing orthodontic movement. I loved the way you categorized them. They were beautiful. Okay, subtractive. You talked about, here, deep marginal elevation. You talked about one type, which is by flap. We haven't talked about any extrusions or material, especially if we have an endodontic crown or a hollow crown, where we might elevate part of the margin with using restorative material. Okay, so it's part of the work. So it's deep marginal elevation. This is the terminology used for this. So you could either bring the gingival margin closer to the surface by extrusion. You talked about extrusion, or you can restore it and elevate it with restorative material. So deep margin elevation is an important role, and usually it's more important in the posterior teeth where we have class 2s, deep class 2 cavities. Okay, deep cavities, and as well we have large contact areas. So you have to prepare to avoid the contact area. So you have to go below the contact area. While because of the long-term abrasion between the teeth, adjacent teeth, the contact area keeps growing. So it goes more apically. So the more apical it is, that means you need to remove more tissue, dental tissue. And so you go to a deep margins. Add to that if you have secondary caries or lesion, deep cavities. So we're going towards the root in those areas. So something about deep marginal elevation. You talked about the work with the periodontal integration. I love this workflow here, where you integrate the intraoral scan with the CBCT. This is very beautiful, and I was just about to tell you, please bring the name of the software and how do they change the formats of the images, and you already done them. So I was preparing those questions, but you already presented them in a very beautiful way. After that, yes, in terms of free gingival grafts and all grafts, you talked about connective tissue graft. You talked about the marginal gingiva in terms of marginal gingiva, but you haven't tackled the issue of attached gingiva. So it's not only changing the marginal gingiva position. There's another more important function of these grafts where we lack attached gingiva. And attached gingiva, lacking attached gingiva reduces the protection you get from it to avoid the movement of the free gingiva, okay? So all of your presentation aimed around the marginal gingiva. Didn't talk about the attached gingiva itself. So adding attached gingiva is one of the purposes of these surgeries. So you haven't talked about them. So what are the functions of attached gingiva? Why do we need it? And how do we apply these? So I know you're going to repeat some of this work, but the idea is it's for the function of the attached gingiva, not only the marginal gingiva. Okay?
Yeah.
So just highlight it more, and you might repeat some of these, as I told you, but when you repeat, only repeat the names. You don't need to repeat the explanations of them. Okay?
Doctora, what do you mean repeating the names?
Because you're going to talk about these grafts tissues. For example, connective tissue graft is one of the techniques to add attached gingiva.
You mean reclassification, reclassify the...
Yeah, reorganize the slides.
Reorganize,
so you're not only talking about the marginal gingiva position, but also at the width of the attached gingiva band around the teeth to protect the prosthesis, especially around implants. It's more important as well.
Okay.
So keratinized gingiva is an essential tissue to be present around a prosthodontic treated teeth, okay, to protect the margins. Okay, you haven't talked about prostosurgery or a surgery.
Yeah, this is the part that I
didn't
have time to go through.
Just mention them. They could be included. Just add once more. In your case, you're going to add 1 or 2 slides only, just to mention them and remind us what we're going to fill in next year.
Yeah, I wanted to talk about the pre-prosthetic surgeries. You know, there is a wide range of management approaches.
Yeah, just add them. And include the names. Include the names only.
I just took
and then just list the types of treatments done, and next year, inshallah, we'll expand on.
Yeah. Okay. Here I just talked about fixed, but I didn't have time to go through the removable.
Okay.
Pre-prosthetic surgery.
Well. Yes, thank you. Okay. You haven't mentioned the wear of tooth wear. Just it should be mentioned in terms of these are one of the cases that need these augmented treatments planning. For example, in tooth wear, compensated tooth wear, non-compensated tooth wear, combination syndrome. These are the cases where we need such a combination of specialties working together. And ridge augmentations. I put here the point ridge augmentations, but it's part of all the pre-prosthetic surgeries.
Yeah. Mm-hmm.
As long as you have mentioned them, even sinus lifting, all of these procedures that might need further consultations. Impacted canines, if you can add them, just try to mention them. Impacted canines, for example, in the ortho, with the ortho. So the assessment is done with the ortho. In the terms of impacted canines, impacted wisdom teeth. Also, when do we consider extraction? When we don't? How do we check that the capsule is intact? the eruption capsule. So all of these issues, sometimes you could just pass by cysts and cyst removals. Okay. Because these are part of the prosthodontic rehabilitation of bridges. Okay, these are my comments today, and thank you very much for your presentation.
Okay, thank you.
All the best, inshallah.
يعطيك العافية.